Well, initially Diann came in and she brought Ovell with her and met with myself and the other manager, and we learned of her level of experience and knowledge with children with special education and working in the schools, and also the level of training that these dogs had in comparison to a typical therapy dog.
And so your concerns were?
Safety, infection control, and then patient contact and interaction. So the primary concerns with safety included how would the dogs interact with the children, and would we have any worries with them, with a child possibly causing them distress, or worried about the children startling the dogs and how they might respond. So that was an initial concern. Also a concern with infection control, with the dog's hair, with them holding toys in their mouths, how would we clean that? And just with making sure that their health standards met our regulatory compliance. We also wanted to make sure that we kept in mind the cultural backgrounds of our patients and how we would deal with that as well. So with our safety concerns, we dealt with that in a couple of different ways. Diann and I worked with the regulatory and compliance officer at both STARS and the hospital, and Diann provided a significant amount of, actually extensive amount of information regarding the dog's health standards, their vaccinations, their health tests that they go through each year. And then together, Diann and I worked with Lene, our regulatory compliance officer, and developed policies and procedures for Dustin's Paw, which included, so how did the dogs actually differ from just regular therapy dogs that were visiting the hospital just as pet therapy dogs? So how would these enhanced therapy and modality dogs be different for us? So that was one of the first things. We also looked at, as far as allergies and latex with the dog's toys, those are two big things, addressing those from a hospital standpoint. So we created a latex-free room and also an allergy-free room, so the dogs and latex toys are not allowed in that particular room. We addressed the infection control by Diann providing the information from the veterinarian annually, along with we have a lot of Sani hand wipes that we use to wipe down the toys after use with the dogs and with the kids as well. We also looked at the certifications with Canine Companions, and just continue to develop an entire list and book so that the dogs would meet the regulatory compliance standards for the hospital. So once we were able to put together the policy and procedure book, the next step was to get approval from our senior leadership team and also the hospital management team to be sure that we were in compliance and that we had their approval. The next step was to get Diann on how would she be able to interact with the patients, her and the dogs, and have that direct contact. So the next step in the process was to have Diann actually go through volunteer services and become an official volunteer. And that way she goes through all of the same health standards and procedures that regular employees have to go through. And that also, by becoming an official volunteer, then she is able to maintain HIPAA and confidentiality, as do regular therapists.
So how do you deal with staff members that choose not to work with the dogs?
It is very individualized, and the way that it primarily works is Diann has provided in-services for us and educated us on what her and the dogs are able to provide. So then the therapist, actually, it's their judgment call to determine if the child they're working with would benefit from Diann and the dogs during a therapy session. So typically, the therapist would approach Diann and ask for her suggestions and recommendations on how they could participate and incorporate and motivate the child during their session. If a therapist isn't comfortable working with Diann, then that's up to them. So, but the majority of our therapists love working with Diann.
Initially, I wasn't quite sure how to utilize the therapy dogs. I'm not really a dog person myself. I prefer cats. But I decided to give it a go because I was observing how the kids just lit up when the dogs came in the room. So I said, okay. And Diann, with her background as a special educator, was also helpful in her training with the dogs. And she was just great at incorporating them into the therapy, really helping me see things in a different perspective too.
Well, when they first came to our facility, my only exposure with dogs in a therapy setting were dogs that were there visiting for pleasure and comfort for patients, like in a nursing home. And I understood that these dogs were going to be part of our therapy sessions. I think my main concern was whether or not the children that I was working with might be distracted by the dogs, or whether they might be rough with the dogs and the dogs reactive back to them. But I found that that actually wasn't a problem in any of those areas. So I've been really pleased with the dogs in my therapy setting. So another concern that we have addressed in our facility are some clients who have religious practices that don't allow them to be in contact with dogs. So we approach the clients at the beginning of their therapy sessions to clarify whether that's an issue for them, and we take great pains to keep the dogs separated from those people in our facility if that's a problem for them. And some clients also have allergies to dogs. So we do have in our facility an allergy sensitive room where the dogs are not allowed to go, so that we keep that room completely clear of dog hair and any other types of allergies that might come from the animals.
I don't think I really had a lot of worries or concerns. I think when Diann approached us, it was more about thinking about logistics as far as, do we have kids who have any allergies to dogs or animals, and how are we going to work around that? Do we have families that have any cultural issues with working with animals? So I think it was more about approaching, having Diann here with those kind of ideas in mind, and how can we make this work and work with all of our patients. And really it was quite easy to do. We set up an independent area that was a dog-free zone for those families that didn't want to work with the dogs or couldn't work with the dogs for medical reasons. And the other areas of the clinic have been accessed. And Diann does such a good job of keeping an eye out for infection control and making sure the dogs are clean and groomed and healthy. So it really hasn't been a problem in the clinic or a concern. So I think when that was really the biggest thing that we thought about when they came in was, and that, and the other concern was also from a financial standpoint, how are we going to be able to help and support Diann to come do that here, and what was that going to look like? Well, we worked over the years with our foundation, the St. Alphonsus Auxiliary Foundation, to help support. We've also, Diann has done grant writing, as well as there's another Dave Dean Memorial Foundation that helps support the dogs. And then I think also our parents have offered contributions because they find it to be a very important service and they really want it to be successful.
When we first started working with the dogs, I immediately saw the benefits for communication therapy. They are great motivators for helping kids to engage, helping the kids to initiate communication, and expanding their communication repertoire. But I was somewhat skeptical about using the dogs for feeding. The feeding sessions, a lot of the sessions that I have, I'm working with kids who have some very strong negative experiences with food, whether this is because of a medical background, a complex medical background, or some strong sensory aversions, some behavioral issues. These were kids that just did not want to eat, did not even want to participate in the mealtime. And so our goal in therapy is to help kids be successful in accepting feeding, but helping to structure the session so that they feel like they've got control of that situation and turning it into a more positive experience. I was afraid that the dogs would not help me to maintain as much control of the session. I was afraid they'd be a bit too much of a distraction and also represent a motivator that we wouldn't be able to fade as we went. But Diann proved me wrong with her high level of expertise in working with kids, in addition to her expertise in working with these dogs who are so highly trained. I immediately came to understand that the dogs provide motivation, but in a way that's more subtle with the feeding kids. They help establish a nice turn-taking routine with the kids so that we're not the ones saying, take a bite, which is what these kids have heard for so many years and feel a lot of pressure related to trying to eat. But instead, they want to participate in that routine with the dogs of, I take a bite, the dog takes a bite. And the dogs are so highly trained that the kids can feed the dogs using a fork or a spoon. The dog will take it from the spoon. There's no concerns about safety or hygiene with the dogs because they're so trained. Food falls on the floor, the dog doesn't get it. It maintains that nice structure and control of the session, but the child doesn't know that. He just knows that he's participating in this great routine with the dogs that's always positive. One of the best examples is the first child that we worked with who came to us after many years of feeding therapy, many years in his little life. He was still a preschooler, but he still could not move to solid foods. He would take small amounts of purees and was very afraid of taking solids. Again, he was very used to adults saying, you need to take a bite, you need to try it. That didn't work for him. But in working with the dogs after a couple weeks, he tried solids, was able to chew them, swallow them successfully. The dog's presence helped to reduce that fear, reduce the anxiety, and the dogs obviously do not pressure him to eat as the child perceives that therapists and adults are going to do. So it was highly successful immediately. And from then on, I've come to realize that this is such a great asset. I'm not sure how I would do some of my feeding therapy sessions without the dogs.
Initially, I was worried about how the dogs would react when some of my patients would interact with the dogs. I have a lot of patients who are unable to grade their muscle movements, so therefore they might react, or the children might engage with the animals a little bit roughly. So I was concerned that the dogs might snap back at them or make sudden movements which would frighten my children, but they react very calmly and they are very helpful to them.
When I started working here in pediatrics, I was concerned about everything, and the dogs were just one part of the whole big picture, but it was definitely new for me. I really just didn't know anything at all about what I would do, but I found that Diann, as the handler for the dogs, had a lot of experience with children for one thing, but she also knew what the dogs could do, and she just reassured me that all I needed to tell her was what were my goals, what was I wanting to do with the child, and she was really good at giving me options for different ways the dogs could help me. So, yeah.
Do you have any words of advice for the administrators in the audience?
Well, I think my advice would be to give it an opportunity and a chance. It's going to be some work to get it set up. It will probably require them to set some policies or procedures up or do a little extra work in the front. It may seem a little daunting as far as fundraising goes to provide for the animals or to find a physical space or any of those things. That can be a challenge, but I think in the long run, once those issues get sorted out, it really is a huge benefit, and it doesn't take that long, to get it sorted out. And I think the thing that people need to keep in mind is it's a collaboration and it's teamwork. So it's about incorporating the handler and the dogs, and whether it's the parents, the therapist, or teacher, they need to work together to come up with that solution and figure out how that's going to work the best. And so I would just encourage administrators to take the chance to do it and to spend a little extra time up front and be open to that, because it's really not as scary as it seems when you initially get approached. It's not that hard once you get the few basic guidelines set up.